everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, today we are here for an insightful session named as The Big Idea Voicing What's Next in Healthcare, presented by VOH. So, this episode is a mini virtual crisp episode series where we feature leading healthcare experts and innovators who are making a significant impact in the healthcare space. So, join us as we'll be delving into their valuable insights and experiences. And to mark this today, we have a very special guest with us, Mr. Varun Gera, who is the visionary founder and CEO of HealthAssure Private Limited. His strategic vision and expertise are driving the future of healthcare management by making significant impact in improving the outcomes. So I would like you all to please join me in welcoming Mr. Varun Gera. Good evening, Mr. Gera. Welcome to the discussion.
Good evening, all. Good evening, Dr. Sumedha, and thanks for the invite.
You're welcome. So let's delve into the discussion. So before directly delving to the discussion points, I would like to know more about your journey in this healthcare space.
Sounds good. So, I'm the founder of HealthAssure, which got established in 2011. So, it's been 13 years of running this company. Prior to that, the other part, which is also healthcare, was I was the CEO for United Healthcare. It's the largest health company in the world. It's a Fortune 4 company, which is not healthcare. As I was in consumer finance. I was in GE Money and ICICI Bank prior to that.
Thank you, Dr. Gera, Mr. Gera, for this. Moving ahead with our title, like what does optimal health and wellness mean to you in context of today's healthcare landscape and for the easy access to provide the quality primary care?
So healthcare is going through so many changes right now, and I think that's all across, whether it's the hospitals or primary care or digital or pharma. I think everywhere where we see a change. So of course, I think as Indians, where we are having a greater per capita income, and of course, our focus has improved more towards saying how much do I spend and focus on healthcare. So that need is definitely shot up quite a bit, especially after COVID. And the changes within India are helping to support that need through a good supply. So yeah, I think we in India are seeing tremendous transformation on healthcare becoming better in almost all the fronts.
Very rightly said, Mr. Gera. Moving ahead with this, what are some current trends or emerging challenges in the healthcare that you find particularly very significant and should needed to be addressed?
So one of the biggest trend which I see in healthcare, and that goes across the world, that whenever the government jumps into healthcare, that's probably one of the biggest transformations that you see. So the Ayushman Bharat, I think it's a very grand ambition for India to cover, a huge population of Indians and covering them with 5 lakh rupees. And now we are seeing even the 70 plus, which again, is a new announcement. So the government is really, I think for them, uh, this becoming a political need to say healthcare for everyone is basic necessity. So this is something which will transform healthcare, how consumers operate, how providers operate, how companies like us, which are tech health companies, how we operate. So this probably is the biggest transformation that we see right now.
Thank you, Mr. Gera, for these insights. You rightly said that the transformation is really required. And if we move ahead, can you please provide us with the insights about the Health Assure and how it provide deliveries to the people out there?
Okay, so let me introduce HealthAssure a little bit more. So, been around for 13 years, we have created the largest primary care network in the country. And in our industry parlance, we call it an HMO network. So, we have created a network in 1,200 cities. In any month, we cover 700 cities, so it's a very wide network. And what is included in this network is a very wide basket of goods. So, for any person living in these 1,200 cities within their 5 kilometers, they can choose from next to the house, within 5 kilometers, a GP, diagnostics, could be X-ray, could be USG, could be pathology, uh, would be teledoctor, home care, even gyms for that matter. So we've created a very wide network, and this is our asset which is there, and we provide this asset to insurers, and we lease it to them, and they use our network, and we service quite a few customers, 30,000 plus customers a month on that. We also have 100 plus doctors in house, which do again more than 30,000 teleconsultations a month. And we also serve corporates. So many corporates, I think typically insurance companies have not covered primary care, they only covered hospitalization. So many corporates want to also provide that service of primary care to their employees. So we service corporates like GE, HDFC Bank, L'Oreal, Pearson's, etc. And finally, we have launched OPD insurance products, and this is in partnership with 5 to 6 insurance companies. So, and I think I'm very excited about that because this changes again the way consumers um, buy healthcare or look at healthcare. So till now, 50% at least of your expenditure was not covered under insurance because it did not cover GP consultations or diagnostics or pharmacy. But now it is, and that's what we have achieved.
Well, it's really insightful to know about this, Mr. Gera. Since you mentioned that HealthAssure started in 2011, so from 2011 till now, what are the major challenges that you come across, and how did you face all of that, and what new strategies are implementing you are into this?
I would say it's a great journey, and a great journey without challenges is not great. So I might not call them challenges, but yeah, I think we have tried to be innovative in the market in pretty much all the business lines that we are there. So and I think whenever you innovate, of course, it takes a little bit longer than you imagine to have the market kind of walk with you. So, so if you may, yes, I think that's one part which is where you might say that the change, how do you bring about change, has been taken a little bit longer. Uh, Other than that, it's a journey of building assets, and in healthcare, building assets is not an easy job. It's a fairly long journey. So building assets, whether it's ground network in 1,200 cities, whether it's having a tele doctor with all specializations from oncology, gastro, GP, Ayush, or whatever. Um, so building a tech platform again, that's fairly complex. And how do having also in the app and a consumer tech and creating products, passing through the regulatory needs for launching OPD insurance products. So I think all of these are you know, I would say industry first, and I think that typically has headwinds to it. The industry is very huge, and the journey is long. So I think this journey is going to be like this. But I think the gratification of changing the industry, that's much greater than talking about challenges.
Very rightly said, and it's really insightful to listen this. Moving ahead at Health Assure, if we talk about what are the new strategies that you are implementing or people can get benefit of that, what are those strategies, and maybe you can share some insights onto that on the upcoming strategies as well.
So I'd say the biggest thing that we are doing right now is um, so so one is creating the insurance products because insurance is by default the biggest aggregator of healthcare. So to give
Yeah.
you an example, I think in the US, top or two companies in the top 10 companies would be health insurance companies. So you can imagine how big health insurance companies become, and they pretty much cover all part of healthcare. So, so this is one thing which we have kind of changed quite a bit in terms of regulationization of how do we cover that, and that that going into many and many hands of customers. How do more and more people buy it, and what are the channels that it gets distributed? So the second part would be distribution. First is the product. The
Yeah.
second is how do you distribute this? So again, I think we've done a fairly good job in distribution, and we acquired more than 2 million customers in the last 2.5 years, only for the OPD insurance. Um, I think where I'm seeing the trends move into is, how does that change our understanding of consumers? So if someone has bought these plans, they start using the plans, how do we understand each consumer differently? And how do we help that consumer get better health, given that, our network is there around them, we get a pricing advantage, we have a knowledge advantage. So I think, yeah, so I think that's where I'm seeing a big trend, and we are moving towards that.
Moving ahead with that, since you have been in the healthcare space since very long, so how did you see this? How it has been evolved from like before 10 years until now? What are the major things that you have been experienced or seen?
I think tremendous. So at one time, we used to pretty much wait for the magic to happen. We used to look at the market and saying, when will the market change? But I think the market's really evolved right now. If you're looking at the companies, in every field, starting from insurance, health insurance, could be standalone health insurance, could be how they're managing claims, could be how they're managing networks, could be tech health companies, it could be regulations. I think now regulations are so much more favorable to remove the shackles and saying, please, do the right thing, but go out and sell and increase the penetration in the market. Um, I think even the entrepreneurship out here, home care companies like us, even hospitals. I think I see a tremendous change in investments which have happened in hospitals, primary care centers, a lot more distribution. So I think there's change everywhere. Of course, I think you've seen how India has become probably the best in a lot of the assets of healthcare. So I keep saying the number of hospital beds of India in Asia are the highest. The kind of doctors that we have are the best. Nurses are the best. We have best pharma in the world. We have the biggest vaccination companies in India. And most importantly, I think the entrepreneurship and, for that matter, the tech talent. So it's changed a lot. So I'm seeing India becoming a beacon for healthcare. I won't even say in 10 years, probably in 5+ years.
Yeah, very rightly said. And it's really enlightening to know all of that. So, in your view, how do you see the definition of wellness evolving with the advancements in the technologies and research terms?
So with wellness, I would include, apart from hospitalization, if wellness includes everything, I would say, you know, first and more, the foremost is the access to healthcare. So the delivery setups, the investment which are happening, I think without that, there's no healthcare. There's no supporting system. So if you don't have the doctors, if you don't have the clinics, if you don't have the delivery, then there'll be no insurance, and there'll be no health tech companies really. So one element is that I think the delivery, there's more access. There will be even more access, and the other allied services, which is the insurance and everything else. I think that's where I'm seeing a lot of change happen, and which has happened in the last 10 years.
Very rightly said, Mr. Gera. Moving ahead, what are the major gaps that you see when we talk about entrepreneurship in the healthcare space, or maybe I would say that the deliverables in the healthcare space, or the service providing in the healthcare space? So, what are the major gaps out there, and how we can address that?
Okay, I would look at the glass, half full. Maybe I would look at, not the gaps, but I think the assets which again have been created in the entrepreneur space. So, so I think tremendous change, almost in every field when it comes to being entrepreneur. But I think what's happened in the last one year is that a lot, if not most of these companies have become viable, which is to say they can stand on their own feet. They don't need funding to survive. So that basically defines the future of the company and the future of this industry. So that was probably one change required. That was probably a gap. But otherwise, I see the entrepreneurship space in healthcare. You know, whether it's large investments like setting up an insurance company, and you have founders like that who set up insurance companies, probably become the biggest in India. To setting up clinics and hospitals and tech companies, um, even mental wellness companies. I think it's a thriving ecosystem out here.
Yeah, very rightly said. So, Mr. Gera, in past 10 years, if I say that there are so many healthcare companies, startups are coming out with different deliverables, different services. So, what exactly has changed in last 10 years? Like how this has become a trend in these days in the entrepreneur's journey or in their lives?
So the entrepreneurs typically look at the need in the market. Maybe they're the first to understand a new need in the market. And it's difficult to understand because if there's a need which is not being fulfilled, the question is whether the need is there or not.
Yeah.
And most non-entrepreneur companies will say the market's not ready for that. But the entrepreneur says, no, the market is ready. I'm going to make that, a bigger wave. And I like that phrase by Jensen at NVIDIA, where he says that we started um, the $100 billion industry, which was not there. You know, so I think so. Similarly, I think the need is there. I think the need of customers to say, "Hey, I need something for my elderly parents," or I need something when I'm traveling. So that's where the entrepreneurs have been able to identify uh, the massive the gap in the market. Like I think if you take the example of even OPD insurance, there was pretty much an accepted norm to say इंडिया में ओपीडी इंश्योरेंस नहीं चलेगा ये बाहर चलता है
Yeah.
और क्यों नहीं चलेगा क्योंकि you're looking at the other markets which have reached a point, and of course the journey you don't see, you see the end point, and you're saying the
Yeah.
end point doesn't work. But it's the entrepreneurs who say, no, it can work even right now, and we're going to make it go to the end point. So, despite not having any data for how much is the claim, despite not knowing that what will work for the consumer, we know there's a need, but what will finally work for the consumer, and how do you make sure that you give it and you honor that promise and make sure that you keep walking forward. So, yeah, I think the market has changed and is changing. An entrepreneur's job is to find the needs, um, in whatever field they're in.
Very well said, Mr. Gera. So, if we talk about the collaborations and the future outlooks, in your view, how important is collaboration between the various stakeholders? I would say the tech companies, policymakers, and researchers in advancing the healthcare and wellness, and to provide a good space in this landscape.
So, Dr. Sumedha, that's probably the most important thing. You know, healthcare is such a wide space, and it's also a very specialized place, and that's where the problems of healthcare start, which is for a consumer who um, is having a need for, say, a physiotherapist, and then going to an orthopedic, and then probably saying, I need to go to a nutritionist. These are all specializations which are, very different. But who is going to be able to string all of them together? And to add to that regulatory part, and if I want to cover pharma within OPD, and how does that work, and how do the regulations work in that, and so um, the end goal of healthcare is how can health be complete for me? How can I stay healthy? How
Yeah.
does my experience not be fractured? So all the stakeholders have to collaborate, and you'll not be able to have one person saying that I'm going to do everything. You'll have to sit down and say, how do we work with you, and how do we understand this? So that's probably very, very key, and that's typically where things also fall down. And I think it's important that we form channels of making those collaborations happen.
Very rightly said, and I think multidisciplinary approach towards anything makes it more easily approachable. Moving ahead, like in your view, how do you foresee as the major priorities for the healthcare industry over the next 3 5 years regarding health and primary care deliveries?
Can you repeat that, please?
So, in your view, how do you foresee as the major priorities for the healthcare industry over the next 3 5 years regarding
Mhm.
health and primary care deliveries?
Okay. So I would say the consumer. I think if you follow the consumer, you'll get all the answers. And typically, I think it's in healthcare, it's very difficult to follow the consumer. I'll give you an example. I think all of us have got experience of getting discharged from a hospital, and it takes sometimes half a day, and some people tell me it even takes one day. So one way is to say, hey, it takes that much time, and thank you very much. The other is, why should it take so much time, and what can we do about it? So yeah, so I think if you're looking at what can be done, I would say follow the consumer, follow the needs of a consumer, and what does the consumer need, and how can I make something um, which is not as complex, which becomes difficult for me to uphold, and then you forget about the consumer. But it's light and easy, and then your eyes always on the consumer. So I would say yeah. So I think it's not very difficult. I think if you just follow through.
Very rightly said, Mr. Gera. Moving ahead, since you were a former CEO at UHC and you are a CEO at HealthAssure, so what leadership style do you embrace and how it has been evolved over the time?
Yeah, it's a good question. So I think in leadership, it's very. I think leadership is something which you keep learning. I think every day, every year, you keep learning. So I think one is how do we get the people to walk with you, to have a vision, and everyone should contribute to the vision. It's not only your vision. There's so much to learn. I think so. What I love seeing is how can you have people who are better than you, and that's very key because if you have everyone which is like you, you'll not be able to make a company. So,
Yeah.
and they're all in their multidisciplinary areas, and they have to be better than you. And how do you still, work with them? How do you still gel? How do they gel with you? And how do you have a vision? And how do you make sure that the execution is great? And I keep saying the culture. How do you make the culture of the company? And culture is defined by, I would say, just two things. One is to be able to think very clearly, and the other is to be able to execute. You know, if you can't think and execute well, you'll not get there. If you think too much, or if you execute, if you execute, if you don't if you don't execute, but if you think very clearly, I think again you'll not be able to get there. So I would say, yeah, in terms of how I've been able to change over many years, um, I think it's about being able to understand the differences in people. Everyone is different, and to be able to look at their skill sets
Yeah.
and why they're different, and what is it that we are looking from that person, and how do you have the person also become more of a complete person while keeping the focus of why are we there in the first place in a company and why are we together. If you forget about why we are working together and you forget about the company, then again I think that's not going to work. So yeah, so I think to be able to think all these things while you operate every minute is where I think you get better with time.
Very rightly said, Mr. Gera, and it's really insightful to know all of that from you. So, in your view, how important it is the networking and the mentorship for a person to their in terms of their personal growth?
Very, very important. I think we don't realize how important networking is. Networking is your own initiative. to go out there and open more windows for yourself. Otherwise, you'll be in your own little hole. Um, but I think every time you go and meet new people, new expertise, new age bands, you learn something more. Um, and I think when you think that you need to learn something from someone a little bit more, that's when mentorship comes in to say, hey, I need to spend more time with this gentleman or this lady,
Yeah.
whoever it is. And I think, and I'm seeing there's a lot of talent in India where even I have, mentors, who I consult with, and there are some startups who consult with me. I think both ways, so it's very important.
Very well said, Mr. Gera. One question in the end to conclude. What advice do you want to give to the budding entrepreneurs out there who are working in healthcare space and who are trying to reach at certain level in the healthcare space with their businesses?
So, as an entrepreneur, I think they've already done the first job, which is right, which is to have the courage to start off. And if someone has not started off, don't wait. There's never a better time. So it is now. But I think if you started off, I think the biggest step you've already taken. The next thing is, patience and a little bit of faith and a lot of hard work. Um, and I think allow yourself to be transformed.
Very rightly said, and I think it is going to be a very insightful for the seekers and the viewers who are watching this. One last question: what if you are not an entrepreneur? What you wanted to be, or maybe what is that thing that actually drives you towards achieving your goals? And other than this entrepreneurship as well.
Well, I believe in putting my mind and hands into many things. So yeah, maybe if I wasn't an entrepreneur, not in the corporate world, I'd probably be trekking somewhere. I love going to the mountains. I probably would be an artist. I like art, so yeah. But yeah, that's for another time.
That's interesting to know, Mr. Gera. So, thank you, Mr. Varun, for sharing your valuable insights and expertise with us today. And it's been privileged to hear about your experiences and exciting developments and your views in the healthcare landscape. So, thank you so much today for joining us.
Thank you, Dr. Sumedha, and thank you all for your time.
Yeah.